Welcome back. Now part 2 of session 12. So as promised, we're going to be talking now about e-technology in healthcare. Regulatory requirements, fierce competition and rapidly emerging technologies are creating new complexities for those operating in the healthcare sector. So if we just take a look at this link now, I've just updated the one that I'm using here in the recording, so that link might not look exactly the same as that in the slides that you've got, but you just need to take the thing off there where it says something about a page number, so just opening up the actual PDF. So that quote, which I just read out, is from this particular report. So Healthcare Reimagined, it's talking about, and this particular diagram is something we'll be looking at on the slides to follow. So it's innovations, trends, predictions and actions for healthcare leaders. So talking about trends in terms of technology in healthcare in general. So there's that quote that I just read out, and make it a bit bigger. So many are working out how to deliver better health outcomes whilst managing evolving consumer needs, behaviours and treatments, along with the significant shifts required to the system. These changes cover all aspects of the ecosystem and operating models, providing a significant challenge for the entire healthcare industry. So, and again, we'll look at these kind of different types of change that are occurring in terms of technology across healthcare and consider how these relate to the practice of complementary medicine. So some things that are happening or predicted to be happening within healthcare, this notion of healthcare on demand, because of the more interactive nature, the use of electronic devices within healthcare. But again, and these obviously we need to be thinking about the types of ethical issues that come along with these as well. So if we're involved electronically with our clients, then we need to make sure that we're not available 24/7 as well. So, but we can see that this is evolving. That there are, for example, multiple avenues for people to be able to access different ways of treatment. Now, for example, in psychology, it's possible to get a Medicare rebate on Skype sessions if you live in a rural area. So this is something that's new, and it's a way that that particular form of healthcare is evolving, and through technology. This idea of consumer-held electronic medical record is something that is more still in development in Australia, but it is certainly something that is becoming something that we're becoming more aware of, and it certainly has the potential to give greater control back into the hands of the consumer or the client or the patient, that rather than information about your health being something that's held by the health professional or the government, it's something that you hold and that you are in control of. So that more a greater degree of equality in terms of between the client and the healthcare provider. Different types of treatment innovation, 3D printed casts, implants, organs, for example. So again, this is something about things where we might be heading, but certainly things to be thinking about: treating and preventing diseases with gene therapy. Thinking what might be the ethical and wider healthcare implications of doing that kind of thing. Personalised and connected health, enabling outcome-based care anywhere. So that, for example, that type of psychological treatment I was talking about, via e-technology, so via Skype, for example. The concepts of wearables, which we're mostly all fairly familiar with. So, say like a Google Fit device, which will give you feedback on how far you've run or how far you've cycled, how many calories you've spent, your heart rate, those kinds of things. But then also the idea of digestibles or implantables. Again, these might be things where we're heading more towards. And then this idea of a hybrid workforce, so how much we'll be working with automation, with artificial intelligence, medical drones and autonomous vehicles, and the physical environment, so evolution of hospital design. So thinking in particular, I wanted to discuss how, and again this is from that report that I just opened up before, so the areas of people and needs, consumerism and market forces, how those ones in particular are related to issues in complementary and alternative medicine. So people and needs, demographic shifts and trends are driving changing needs in care. So thinking about that move towards being more client-centered, that the client is more has more say in what happens in their healthcare rather than being driven by the health professional. So with that shift, how does that sit perhaps more nicely, more adequately with the CAM strategy? Consumerism. Patients as consumers will grow in importance and demand the best in class service. So again, this idea of greater knowledge and knowing that, well, health knowledge isn't something that's just in the hands of the few, and that consumers, clients, patients can make informed decisions about what they want to do in terms of their healthcare. And market forces, so new entrants and incumbents cause disruption and convergence. So what are the types of changes that are happening within the market, and how is that affecting healthcare, and in particular in relation to complementary and alternative medicine? So still talking about e-technologies, the internet in concert with affordable mobile devices facilitates a fast connected experience to consumers. It also provides the healthcare industry with the means to provide greater transparency and choice, for example, to satisfy consumer needs for relevant information and advice, and tailored tools that can monitor, assist with diagnosis and treatment wherever consumers are. So just different medical technologies that can help with monitoring. So, for example, the wearables, or just different types of ways of being able to assist people remotely, as I've been discussing. So, all these are directions that are opening, that we're moving into, which are opening more choices for clients, and particularly a wider array of clients. Also, this issue about the availability of more information online. Again, it's something I think that it is giving greater power to clients, to consumers, to patients. But of course, we all know about the fact that there's lots of information that's available online that's not necessarily of great quality, and so there's that kind of negative side to the fact that there is more information available. It's not always of the best quality. So digital platforms that connect healthcare providers directly to consumers means treatments and reminders can be easily communicated and tracked. So yeah, things, just for example, sending reminder messages that most healthcare professionals will send an SMS or text message to their client to remind them now. Appropriately linked social media can provide consumers with access to extensive knowledge base. Again, as I was saying, it's about being able to provide quality knowledge and in a way that the public, the clients, consumers can recognize that is from, that knowledge is trustworthy, that it's evidence-based, for example. And so we can do that by creating social media accounts as healthcare professionals, but of course they need to be separate professional accounts rather than our own private ones. And of course the benefit of connecting with others who are experiencing a similar condition. So there's that psychological benefit of being able to share or knowing that you can talk to someone who's going through something similar as you are, and then of course perhaps sharing knowledge around things that have worked for that person living with that condition. And on that note, studies have shown that social media in healthcare can enhance psychological well-being and improve self-management and control. More equal communication between patients and healthcare professionals is also improved. So, yeah, at the level of equality in between the healthcare professional and the client or the patient is increased, which of course can have positive psychological effects as well. Okay, let's take a break, and then we have the final section for this final session.